Vanessa James.
When possible, make a U-turn and turn left.
Vanessa James.
I'm here.
Okay.
Hey, Shelley, thanks. We've
Hey.
got folks just coming in, so we'll get started in a couple of minutes.
Okay.
Are you going to have audio, Shelley, or just, video or just audio?
Just audio since I'm at the house.
Okay.
And this is Vanessa James.
It's funny, it started snowing again over here about an hour ago, but I think it just slowed down. It just stopped.
You need to move back this direction, get out of that snow.
And well, I can't believe it. If I could bring the grandbabies with me, I would.
They wouldn't mind.
Tell Ronnie not to give me a hard time.
Well, he's not here yet, so I just texted him to ask him if he was still coming.
Yeah, we can volunteer him for multiple things if we need to.
Turn right on Westwood Drive.
Is it taking a circle? Or?
I looked, I think Macon County was the only county that didn't have a delayed or canceled schedule in the far west.
But we'll see if they can't.
In 1/2 mile, turn right on US 221. Turn right on US 221. Turn right on US 221.
All right. Unless it wants this one. Maybe it's up here.
Turn right on Thompson Road. In 1/2 mile, turn left on US 221. Turn left on US 221.
Shelley, it looks like that we have a couple of people on the phone and we're still waiting for county officials. We have folks from probation here, but Ronnie and Derek and Sheriff Holland are not here.
Okay. Let's see, I'm trying to look at you want to give wait till 1 more minute, or do you know if they're coming, or?
I don't know if they're coming. I just got a response back from Robbie that he forgot about it. I texted Ronnie and Derek and I haven't gotten a response back yet.
Okay, well, I mean, it's up to you, Tammy. We can, if you want to go ahead, we can. And then if you know, circle back with Derek and Robbie if we need to. It's up to you. I want to just respect everyone's time. I see Justin is on the phone. I see my employee number, so I assume that's mine, and then a 919 number.
That's Vanessa James.
Oh, okay, okay. Hey, Vanessa.
Hello.
Okay, is anybody else on the phone or on the Zoom meeting? Okay, so Shelley, if we want to go ahead and get started, we can, and if they make it, they make it, but I want to respect everybody's time.
Well, Tammy, since you're in the room, do you think we could do introductions? And then also maybe would you be willing to take a moment and just talk briefly about sort of the Western Region Recovery Alliance and what brought us here? Just take a moment and then we can go from there.
Sure. So we'll start with introductions. So I'm Tammy Keyser. I am the assistant health director here at the health department, but I am also the facilitator of the pre-arrest diversion and post-entry regional group that was established through a seven county regional recovery initiative that has a summit annually in Bryce City, and that was held a couple of months ago. And so that at that summit, we each group, we were divided up into groups, and each group had to pick a project that they were going to work on for implementation for the next year. So my group elected to focus on sequential intercept mapping because it is a program designed to facilitate services and access to services for folks that are involved in the with juvenile justice, or not juvenile, I'm sorry, with the justice system. So that's who I am, and Shelley Foreman is on the phone with us, and she's going to do the majority of the talking and explanation today. And so we'll go on around and let you guys introduce yourself.
I'm Justin. I'm a Master of Social Work intern at Western Carolina University. And I'm here till May.
My name is Cheyenne, and I'm your intern.
I'm Nick Leatherman. I'm a probation and parole officer here in Macon County.
I'm Elisa, and probation parole officer here in Macon County as well.
I'm Tammy Welch. I'm filling in back there in the health director's office, and I'm taking notes for all day.
And I'm Vanessa James to the North Carolina Department of Commerce that has a reentry program, and I'm the regional specialist for Western North Carolina, covering 22 counties, including the 7 that are mentioned.
Justin, you want to introduce yourself?
Audio.
Sure, yeah, I'm Justin Wright with Sunrise Community for Recovery and Wellness, and I'm the RCO program director over there. Also was the felony drug diversion program coordinator for Buncombe County until recently when my role changed, and I'm also involved in the Safety and Justice Challenge as a part of the racial equity work group.
Okay, and Shelley, it looks like that Derek is on his way, but if you want to go ahead and introduce yourself, and then we'll get started.
Okay, I see Ted Duncan and Alan Boyles joined, but my name is Shelley Foreman. I'm the Regional Community Relations Director for the Far West, 7 Far West counties for BioHealth. Did we have Alan and Ted, did you join?
Yes, can you hear me?
Yes.
This is Alan.
Alan, do you want to introduce yourself?
Yeah, I'm Alan Foyles. I'm the case manager for First of Blue Ridge out here over outside of Black Mountain.
And Ted?
I think that's Deborah recording the meeting for us, Shelley.
Okay, okay. As Tammy mentioned, we all came together as part of an annual event that brings folks together who are supporting folks with mental health and substance use disorders. And in our group, the whole rally, folks broke out into groups and areas of interest. And I think, Tammy, you gave them the handouts about the sequential intercept mapping. And I'm trying to see if I can see it. So several years ago, the state of North Carolina, and Ronnie Beal was actually a part of this because it was sort of, it was talked about at the National Association of County Commissioners organization, and then the North Carolina, at the national level, and then the North Carolina Association for County Commissioners adopted a program called Stepping Up. Stepping Up is a program, it's really sort of a concept. It really is about bringing communities together with the support of their local government to look at ways to develop better solutions for people with mental health and substance use disorders that are coming into and coming out of the judicial system, and really trying to look at ways to keep people out of detention centers for behavioral health issues as much as possible. And so Macon County was one of the first counties. The Board of Commissioners passed a resolution saying that the Board of Commissioners supported the community engagement in the Stepping Up program. And so that was great. But part of what the statewide initiative looked at was, well, communities may want to be able to do more, but in order for them to be effective in doing that, we really need to have each county look at sort of what is currently happening, as well as what are gaps in services for people along the continuum of care who are justice involved. And so the state of North Carolina engaged with a consulting group called Policy Research Associates to adopt a program called Sequential Intercept Mapping. And the sequential intercept mapping model really looks at developing a process for how we as a community bring people together to, in a very methodical way, not only bring people together, but to create a map of what is currently happening in the community for court-involved people with mental health and substance use disorders. And from that map to then really look at priorities. And so when the state brought in this organization, it was all wonderful, but they are very pricey, and they basically charge anywhere between $25,000 and $30,000 to come out and work with local counties and communities to develop this map, and from the map develop a list of strategic priorities. And you know, most of our counties can't afford that. So through some grant assistance at the state level and support through multiple organizations, the state of North Carolina had about 25 to 30 people who were able to receive training in how to facilitate this process, so that communities in North Carolina that wanted to do the sequential intercept mapping could do so and do it at no cost to them as far as having the facilitation done. So instead of costing the $25,000 to bring in PRA, we now have a cadre of people in North Carolina who are trained to lead this process, which is a great resource for our communities. So when we started talking about developing how do we develop solutions for people who are court involved as part of our planning group, we really thought that if we wanted to be as thoughtful as possible, that maybe we as a group could promote the use of this sequential intercept mapping and try to bring communities together to do it. And as we really began delving into it, it sort of became clear to us that there were 1 or 2 counties that had sort of moved ahead in their approaches to how they dealt with people, especially with the substance use issues that many of our communities are feeling. And our group really wanted to then focus in on Macon County and asking folks in Macon County if they would be willing to engage in this 1.5-day long planning process and strategic planning prioritizing to look at not only what we're currently doing, but what we would like to do in the future. The map that Tammy has given you, and then I'm gonna close out, I just wanted to be able to, I'm looking at it as well, is so when you bring people together, you look at these points of interception, intercept 0 through 5. So really you're looking at what are the community crisis services, who in the community would be getting either those 911 or those mobile crisis management calls. Intercept 1 then goes into local law enforcement and how they become involved in getting a call around someone who has a mental health or substance use issue. Going from arrest to intercept 2, initial detention, court hearings, through 3, they're going to either specialty courts, they're going to jail. 4 would be coming out of jail, re-entering the community after they've been in the detention center or prison. And then 5 is probation and parole. If they've come out of the detention center, are they still dealing with probation and parole? And so along each of these areas that intercept, the community really brings the key players together who are involved in each of these segments and really looks at not only what we're doing, but where are there points where we could develop either policies, processes, new programs to try to divert people. And the ultimate goal is to try to, 1, divert people from ever getting in the detention center, and 2, to reduce recidivism. So if they are in the detention center, how do we help them get the things they need when they're out that will help them be successful in recovery? Okay, so I'm gonna stop there and just let you guys talk a little bit more about the process, your interest in the process. I sent over, was able to go to the office to make a copy of the planning guide, because what we would like to do today is, 1, answer your questions, hear what you think about this planning process, and then 2, talk about if we would like to do the sequential intercept mapping in Macon County, what would the resources, what kind of planning committee we would have to have, and sort of next steps for that. Buncombe County is the county closest to Macon that has gone through this process several times, and they've been very successful in developing not only stronger relationships across all of those points of interception, but also new programs, new services, and new ways to support people to be successful. So Tammy, maybe you can sort of facilitate with the group the questions they have or their possible interest in it. I was so glad to see probation and parole there. And we're also glad to have our regional representative for reentry programs, because one of the things we'd like to do is look at not only what resources and supports and people we need to bring to bear, but along those areas, where are the financial resources that we might have to be able to do more in our communities.
Okay, and we also have Derek Jones joined us from the detention center. Robbie sent him over, so we have a representative from the detention center as well.
Great. Well, and the detention center is doing some great programs now. But, you know, and so I think it's just, that's one of the reasons we thought Macon County would be a great place to start, because of the attitudes and philosophy of people in the community and the current things that are happening.
Okay, so I think we said this, I'm not sure now, but Shelley was going to actually be here in person today, but she's stuck in the snow in Asheville. So I know this is kind of hard to be doing this type meeting without her present in the room. So she's just given the brief overview of this, and of course a lot more is involved in it. So what typically happens is that once a community signs on to be involved in this process, interest in it, then we start with smaller groups of folks that would work on a specific area of the intercepts. So if it is that, you know, the intercept 0, where it's the crisis communication, it's those calls to 911, then that's more of the group that we would have in that part. So it wouldn't require everybody to be in every piece and part of it, and lots of meetings. But the purpose of today's meeting was kind of our kickoff to introduce the model and to see if really there was support and buy-in from Macon County in moving forward. As she said, there are a couple other counties in the West that have started the Stepping Up program, but the group, which most of them are on the phone, on the video, that we're working with through the summit, felt like that Macon County was in a better place to do that, and that's where we wanted to focus our energy and our efforts. And then as Macon would get this up and going, then we would roll it out to other counties, and they would kind of get to follow the model that we've done here. So what questions do you all have, thoughts that you have, challenges that you have, that you wonder if going through this process might help or not help? Derek, what are some of the biggest challenges that you all are seeing right now as far as the detention center, with people coming out and having services to get connected to? I know that you guys are working with No Wrong Door, and you've got Samantha who is trying to connect, but are there still challenges there and questions about whether services are available and where for folks to go, and housing, transportation?
Well, and the only thing I really see here with that we're having an issue with is with the medication. I mean, we just changed medical providers when it came to pharmacy anyway, and we saved thousands of dollars, thousands upon thousands just in the last 3 months. But it only lasts for so long, and so they're gonna find what they're gonna get anyway. So I mean, that's one of those things where we're following the intercept model more than the way I'm reading it. But you know, she's talking about repeating recidivism and everything, but I don't know what we can do differently. I mean, like I said, we're providing that. We're also providing mental health counseling with Sarah. And Sarah does 2 avenues, whether it be group or one-on-ones. So we just added the job, NC Works. So I know that we've gotten 3 out that we're able to go and get a full-time job upon release, you know, $12 plus an hour. So hopefully that also assists. It's working with them in the building resumes and job search. So.
Well, and one of the pieces of this is making sure that we have a map, so to speak, of all of the services that are available to folks pre-arrest and diversion and reentry. And so we, in this room today, pretty much know, I think, most of the services that are in our county, but there are services or programs that serve Macon County that aren't here. So if you had somebody who was coming out of the jail that needed housing, that list of shelters that we could send folks to, or the list of treatment programs, all of those things will be part of this mapping process. So what about you guys, as far as probation and parole? What questions do you all have, or what challenges are you all seeing?
When you said that about like sending them out of county for housing, a lot of times if their crime was committed here, they won't let them go somewhere else for shelter.
Mm-hmm.
So they have to stay in the county of origin. So that's a huge problem for us.
Uh-huh.
I picked a girl up 2 weeks ago and pitched. We had to get her a tent to pitch in the woods. I mean, she's a homeless, sex offender, but still, we just finally found somebody through no wrong rule that would take her in. And then we got her a job, but there's no transportation that runs past 5. No public transportation. So then here we are trying to, me and Samantha juggle this girl's schedule, picking her up late and taking it. It's just impossible.
Right.
I mean, it's so limited. And she's trying, so you'd hate to not help her. I mean, and she can't walk in 30 degrees weather when they're outside and it's pouring the rain. So, I mean, and she's determined. I mean, she's doing well, but in her meds, thank goodness when she left the prison, they gave her a 30-day supply of meds. So then we can get her set up to get something else available.
So one of the great things about this process is that if you look at it across all of those points of interception, we know that there are lots of good things happening, but we also know there are a lot of gaps. And many times for us who are in the public sort of sphere, we don't necessarily always have the ability to make a lot of inroads in things like housing, getting somebody a job, getting them transportation while we try. But so what this planning process does is it brings people together from each of those points of interception. And when you develop the map, you really actually physically list, here's what we're doing, and then we can begin to see the gaps. And from there, those groups can really begin developing some priorities and saying, okay, for us right now, housing is the #1 issue, transportation and housing, that type of thing. And it really allows you to have a methodical way to move forward. And at the same time, we can say, well, we'd also like to have a better diversion process. So, how do we keep people that we interface with from even getting to the detention center, or can we do something pre-arrest, pre-booking, or at the time of booking, or, to do something different. So it just increases what you know about the community, plus it also gives you an opportunity to identify new tools that you would like to adapt to be able to really, have more impact. And that map, along with the priorities the group establishes, has really had a lot of significant impact in the communities where they've really done it. In Buncombe, they've actually done it several times because they've met their first goals and then they've dug deeper to do more things.
No, she's there. So are there other questions or thoughts that you'll have about the process? So Derek, I know we'll catch you up a little bit. So I know that we had some conversation, Shelley had some conversation briefly prior to this with you and Ronnie about it. So this model is a national model that's being followed. And through that 7-county regional summit for recovery, our group that I am the facilitator for, that's about pre-arrest, diversion, and reentry, selected this model as implementation in the Western counties for our project. And that group felt like that Macon County was the place to start because we already had the Stepping Up program implemented. We're doing lots of great things in our detention center. We have No Wrong Door providing lots of good services. We have the employment program. We have all kinds of things going on in our community, our task forces. And the only 2 other counties in the West that had initiated the Stepping Up program, Shelley, are Haywood and Graham, is that correct?
They've passed, the counties have passed the resolutions, yes. But those are the only 2.
Our group felt like that Macon was the place to start. And so today is our kickoff meeting to kind of introduce the program to you all. Shelley was going to be here, but due to the weather, she's in Asheville. And so she's just gone through basically and described the program and opened it up for questions.
And again, the training itself, we have 2 people I've already spoke with that that are in this area that would be willing to facilitate the training. The day and a half, instead of, like I said, there's no cost for the facilitation and to go through the process. We have, I actually made a copy of the planning guide that's included in the training manual. So it even, when we did the training with PRA, they actually lay out like how to go through the planning. If we want to go ahead and do the planning session and do the community mapping and setting priorities, it talks about who would need to be involved in the group, who would need to be invited, what you need. So it's a really, they've sort of set everything up for us to, if we want to go ahead and do the sequential intercept mapping, we have all the guidelines, we have the facilitation that's at no cost. You know, we would have to think about who would want to be on that planning group and how we would then move forward in planning to do this so that it would be successful and having all the right people there. Would anyone be interested? I don't know. I can't tell if Tammy, if you're on mute, but Justin is on the phone who works with Sunrise Community that's participated in some of the projects or the mapping in Buncombe County. Maybe he could tell the group a little bit about some of the things that have been an outcome of just getting folks together in a room and developing the map and setting some goals. Justin's on mute.
Yeah, he's sometimes in his office where he can't unmute, so.
Maybe he had to step away.
Shelley, it's good to hear you again.
Pardon?
I said it's good to hear your voice again.
Oh, I'm sorry I'm not over there. I've had a couple, it was snowing early, then it started snowing again, and I was afraid to drive over 2 mountains, so. Can you see the chats?
I have to get up and move across the room.
He says he's unable to unmute for some reason.
All right, can y'all hear me?
Oh, yes, okay. Justin, we were just wanting, because I know it's very hard to have, you know, and I feel bad I'm not there. And the only reason I'm sort of talking about the sequential intercept mapping is BIA was able to have several folks who participated with the state in the Stepping Up initiative and getting the facilitation training here. So that's pretty much the only, why I'm sort of talking about it more. But Justin actually has gone through it and can maybe give you guys some ideas, some of the impact that SINS has in the community where he's working currently.
Well, I'm not 100% sure on the total impact for the county as a whole. What I do know is that the process that I went through was really enlightening. When you have the right people at the table, you start to realize that not only are there system gaps, but there's plenty of system gaps that can be dealt with actually kind of quickly when they're identified and you have the right people there to make the decision. And so something that this process is pretty important for is that time spent to not just identify where people are falling through the cracks or how to move towards a better system in the criminal justice system, but it's just an amazing tool to be able to really lock down some hard and fast plans that you can move forward with. I know that most of us probably go to a lot of conferences, a lot of meetings, a lot of, hey, let's get this stuff going, and the list of people who hold on to those things gets less and less over the time spent, and it kind of falls apart and nothing ever really happens, and that's very frustrating. With this SIM model, it's been my experience that, at least for Buncombe County, when those gaps are identified in the handout that Shelley sent over, we're able to actually act on those things in an absolutely real way for real system change stuff. And that's what excites me about this particular model. So from a buy-in standpoint and from a knowledge standpoint about where the system gaps are, what resources we have, what we need, I think it's kind of an essential tool. So that's what I can comment on.
Well, and then, Justin, it's brought a lot of money to Buncombe County. One of the things, if you go through this planning process, and when I say planning process, it's a day and a half of time where people come together, go through that mapping, develop priorities, and then, subcommittees come back together. But Buncombe County, by doing that, has been able to pursue grant funding, state funding, other types of funding resources to develop new programs that they might not have been able to had they not had that community map and the priorities and that planning group together.
Yeah, that's exactly right. I mean, the felony drug diversion program is part of a diversion program that is super important to our county, but Sunrise itself just received funding to be able to onboard a peer support specialist who is working inside the detention facility and outside to help people transition from medication-assisted treatment when they're inside the detention facility to being outside. And, that's a brand new program over at Buncombe County where we have medication-assisted treatment inside the detention facility itself. And so that was a system gap. As of, I don't know, a few weeks ago, if there was an MAT program and there was no one there to help facilitate the transition when they would leave the program, then we know that those same people who were on their road to recovery would then go back to whatever same dose they had on the streets prior to that. And then not only would recidivism go up, but the death rates, would continue to go up. So it does bring a lot of opportunities to be able to partner with other agencies for grants once you've identified this problem.
And it's a beautiful thing I was there at Buncombe County when some of the initial meetings took place with sequential mapping, and to have all those resources in the same room, just even that collaboration and networking was amazing to realize which each resource brings to the table, and also realizing that each resource brings a lot more to the table than just their first, what they first present. And to put all of that information on one board or several pieces of paper and actually analyze what the needs were, as the representative from Sunrise has said, has produced a lot of grant money there in Buncombe County.
And I guess one thing I forgot to mention is as part for the first part of the session, the day where you begin the mapping, the planning group would work with all of our key community partners to collect both the existing data, you know, like what do we know, like how many people are coming into the detention center with mental health or substance use issues, how many people come back through. There's sort of a list of data they ask you to collect, but it also would allow us to introduce you know, focus group or listening session information from people who experience mental health and substance use issues, who have come into contact with the justice system. And the planning group itself we would want to include people like Samantha, who are actually peer support specialists to help with the planning as well.
I will say this, I feel like it gave me personally just an opportunity to wrap my head around the whole process that somebody who's criminally justice involved might go through. And I'm not just the participants, but even down to law enforcement. So when we have people who are going through the system 10, 15, 20, 30 times a year, law enforcement get to know those same faces. And in some ways, it's the person's responsibility, but in some ways it's also the system's responsibility to say, okay, what's not working with us? Is it possible for, you know, peer support or an agency who's crisis trained to be able to be a first call for a law enforcement officer when they don't just want to rebook them on the same charge if there isn't a charge, if it's loitering or whatever the case may be, so that they then don't go through that whole process? Or are they on purpose going through the process because they're hungry and they're cold? So all of those things were some really important things that I personally got to learn at each of the intercepts that we see here throughout that model as well.
So Tammy, maybe you could see what folks think about the idea of going through this documenting and going through this process.
Thoughts about that, guys?
Shelley, this is Derek Rowland. How you doing today?
Good. How are you?
Doing good. I had a question for you. Is any of this sequential intercept model, is that going to be referenced or included in any way in VIA's community plan? And has the community plan for the catchment area been adopted yet?
Well, VIA has been a part of the planning to bring the consulting company, the PRA, to the state. Myself and Donald, we participated, and we have we could use facilitators from anywhere in the state, but we actually have 4 people from the VIA catchment area who are trained to do the facilitation. So we've been supporting this process. We've just, I think it's been done in Watauga County, Buncombe County, and now we're trying to bring it to Macon. And part of this, I don't know if you heard, Derek, this planning process was sort of adopted as part of the North Carolina Association of County Commissioners Stepping Up initiative, where the association really brought counties to talk about this issue. And I know your county passed a resolution. And so this is sort of the tool. I mean, and this is really, the sequential intercept mapping is a tool of really documenting and prioritizing at different levels of people's, you know, along that continuum of intercept points, what we would like to do, what things we'd like to focus on. So yes, this is something we're supportive of and have been participating in, and can definitely bring you resources for the training for free instead of the $25,000.
But this doesn't play into the community action plan that
the community crisis plan?
Yeah, I'm sorry.
Yeah, well, this is I think one of the things is, I think that this is a great tool to help mitigate the involuntary commitment crisis response. If you're developing points of interception and trying to intervene early, I think it would be a part of, that's part of developing better solutions. So it certainly is a component of it.
Right. And I'm kind of getting, have you all adopted that community crisis plan yet, VIA?
Well, VIA has, and it's been approved by most of our counties. We're just waiting now to hear back from the Department of Health and Human Services to see if they had any questions. We're actually starting to meet tomorrow, and we have several meetings set up with the, now I'm going to get off on a totally different tangent, but with the prenatal health plans for Medicaid transformation for the standard plans, because they will also be they need to be participating in the community crisis plans. So we're waiting to hear back from DHHS as we speak.
So it's not a finalized document yet, right?
It's final as far as we're concerned, unless, I mean, from our perspective and the community's perspective, we've not had any suggested changes, and I don't think we're going to hear anything back from DHHS.
Okay, thank you.
And so I guess what, Tammy, if you want to look at that planning guide, if folks do have an interest in going through and doing the sequential intercept mapping, the planning guide really just talks about, and I think what we wanted to do today is say, are we interested? Would we like to explore it? And then, have some folks like, we definitely need, there's some key people we would need to have participate in our small planning group to sort of make sure that we're developing a successful planning process.
So Shelley, can you talk about who the key people are that would need to be a part of that?
A part of the planning group?
Yes.
Let me just, I'm gonna, hold on, I'm gonna actually redirect this on it. So the people basically, hold on, I'm sorry. So we would want to, in just the planning group, have folks from the criminal justice system, which would include, like folks you have there from detention center, community corrections, police, probation and parole. We'd want folks from the mental health professionals. So VIA, we could maybe get one or two of our providers. So we would want folks directly involved with mental health and substance use folks. We'd also want consumers, or so basically some of our peer support specialists or people who've used the system. Those are the folks that they're saying would be great as far as part of the planning group. And then they have a long list of people, and even sort of the breakdown and the percentages of folks from leadership to line staff for the actual day to be invited to participate in the planning. And I think you have that there with you, Tammy. But, who to invite really looks at even levels of representation, top level administrators, mid-level administrators, frontline staff, and peers. So what you're trying to do is get feedback from, both people who are boots on the ground, then people at the highest levels of leadership. And then you also want people there who are decision makers who can, as Justin said, if something is like, if we do this, which is a very easy thing to do, let's say, all we have to do is, yes, we agree to do that today. So the workbook is pretty much that whole planning session, just, and I don't think it has to be a large planning group. We have folks who already are part of the planning from the Recovery Alliance, but I think, in order for this to be successful in Macon, we'd have to have some volunteers to at least participate in helping us with some of the planning, which is, pretty outlined in this manual that I sent everyone.
sound like it's a process that's worth going through to try to identify our gaps or what's available that we may not know about, and to also see if there's maybe potential funding resources, or if somebody has financial resources to lend to help with one of the challenges that we're currently facing.
Derek, we're volunteering you.
You're talking about Roland, right?
No. Well, we'll volunteer. How about both of you?
I was just making sure.
Yeah.
I've already left the meeting.
Don't worry, we can track you down.
Fine, yeah, I'm not that hard to find. You know that if you need anything, all you gotta do is call. But I think obviously the detention center is the probably the first door that you open when it comes to the process here, because once they come into us, we try to offer them everything that we can to change their way of thinking before they're released, whether it be free of charge or probation or they get sent to prison. Are we looking at meeting periodically in regards to this, or just is there anything set in stone right now?
No, I mean, we're just wanting to see if we would like, what we'd really like is for folks to say, we'd like to move forward in Macon County, and then Tammy and I and others that are part of the existing group can reach out to those that we would like to be a part of the planning group and just get busy planning the day.
And I think from my standpoint, obviously, I support it 100% in moving forward. After seeing what's going on in surrounding counties and those counties reaching out to us, whether it be on the health side or whether it be on the detention side and so forth. Because I know in Swain County alone, they were on the outskirts of trying a couple new things, and they had called over. I spoke with Clay County as well. Right. So obviously I'm for moving forward.
And Derek, our goal for you is to develop some new strategies to keep people from even getting to the detention center. So.
Yeah, that'd be great.
And then probation and parole, you wouldn't even know. You wouldn't even have to worry about it.
Yeah, but then they wouldn't have a job.
Oh, they'll have a job. There are lots of other crimes that people commit that aren't related to mental health or substance use challenges.
Yeah.
Well, and then the big thing is bringing people from out in the community who could really help us with the housing, with the whole reentry, you know, housing, transportation, jobs, job training, that kind of thing.
Uber.
I've always said a peer Uber model. Start a peer Uber model. I've been promoting that for a long time now. How about probation and parole, folks? What do you think?
I mean, I definitely am interested. I feel like I've been in some of these meetings before, and we always hit brick walls, and there's either not funding available or we lose resources. I mean, we can try it. I'm game. Yeah, we'll try anything. We always need help.
Well, and the thing is we're trying to take instead of just the pressure being on certain points of interception, is really looking at, you know, trying to keep people out of the system and, you know, and intervening earlier so that you're not having to struggle with things in probation and parole and having people coming out and having to sleep in tents. I mean, we may never solve 100% of the problems, but it might bring you some support from other areas that will make your job easier.
Yeah, we're on board. Samantha Brawley, she's done amazing up at No Wrong Door. We need about 10 or 12 more of her.
Now, did you say Samantha?
Yes. I did. I said we need about 10 or 12 more of her. She's done amazing work already.
Well, this is, I don't usually mention, but that's my niece. Samantha
Okay.
is my niece. So I love to hear that. I love that I'm working with her like in this, with No Wrong Door, because it's been great. And I'm glad she's helpful to you. But
Yeah,
she's a perfect example of how we can turn things around for people.
Yes, she is. She's doing great work.
So Tammy, what are your thoughts? And I see Carmine's on the phone. As far as moving forward, what are your thoughts? I know we don't want to plan anything in the middle of winter. I think we could maybe get a planning group together, because the planning group could identify the space, get the meet, you know, we could do a lot of work for the next month or so, and then try to have it, you know, when it's going to be more convenient for folks as far as weather, when it's warming up a little, maybe.
So I guess our initial plan was to have this meeting today, and then if there was support in moving forward, was to do a presentation next Tuesday to the Mental Health Task Force, which also has members of the Substance Use Task Force on it as well, and let them know that we've had the meeting today, that there was support in moving forward, and start gradually getting people on board and prepared for that first meeting, as Shelley said, that we were thinking about after the holidays, when we all come back with fresh minds and spirits in January.
And full bellies.
And full bellies and lots of Christmas gifts and goodies and all that. So, Derek, did you have any other thoughts or comments? She asked everybody else while you were out of the room. So,
Yeah, I think it's good. You know, like the probation and parole folks were saying, anything you can do can help. And, you know, I'm a lot like Elise too. You know, you spend so much time planning this stuff, and it's like you develop all these great plans, but then when it comes to putting where the rubber meets the road, there's no funding available. So, you know, I think when we discuss it further from a county standpoint, there's not going to be any state funding available to help implement some of these things. And as far as that goes, we need to get creative with the things we're doing and see how we can incorporate it into our existing budgets.
Yeah.
You know, so I mean, it's great. It identifies each step and an opportunity to help some folks out. And you know, that's what this thing's all about. That's why we're all here.
And not just helping out people with behavioral health issues. I think Justin made a really good point earlier, is through this process, it helps you develop more relationships across sort of the justice system and the continuum, and looking at what's available. And so professional support for the people who are sort of, you know, on the front lines doing this work every day.
Right.
all right. So, Shelley, it sounds like that there's support from this end. So, I guess we'll move forward with our presentation next Tuesday, and then move forward from there.
Right, and maybe for those folks, you know, especially you know, Derek, you're always going to be a point person because of the detention center. You know, that's sort of a main hub. But for the planning group, obviously, when we have the actual event, you know, there'll be lots of people there. But if they're maybe amongst yourselves, think about who from probation and parole. Is there one person who'd like to participate in the planning? Or are you going to share that role? But I know, Tammy, we can be back in touch after the 19th, and because we're really wanting the mental health and the health department's mental health task force and substance use task force to sort of get behind this and help support the planning as well.
Meeting next Tuesday. Board I'm on, I don't even know.
Okay. So is that all we need for today, Shelley, or?
I mean, I guess the whole group, I mean, what do others think? I mean, I guess I feel a little awkward. The only reason I'm sort of talking about this, the sequential intercept mapping is just because we have the module and the materials to help plan it. But others, you know, from the Alliance, if you have thoughts, I know we all really want to move forward. And I think Macon is a great place to do it. And I just, like I said, we can't say enough of, you know, I work in Macon. You know, I don't work at the county level, but I support Macon, and I really think it's a great place to start. I think you guys have, there are a lot of opportunities for, we're very successful in Macon with what we're doing. I think there's even more opportunity for growth and success. So I think it's a great place.
Another thing I will add, Shelley, one thing I see as far as the county is concerned, you know, with Eric here, he's here on behalf of jail, so if he and the sheriff are good with it, I'm great with it. One, I do see though listed here, our 911 and our dispatch. So I would like Warren Cave to be involved in these discussions and in the planning phase as well, because it's going to affect and impact his dispatch office.
Yeah.
And that, yeah. So our dispatch, and that's the only. Those are the only county thing. You know, of course, the health department, any role they have, if Carmen and Tammy are good and see any role for the health department, then I'm fine with it. I just want to be sure that all the agencies that are going to be obligated or are going to be part of this have signed off.
We definitely will circle back with those that weren't able to attend today or those that we identify as missing that we need to get involved, because really when we would meet again would be to begin the really thinking about how we move forward with the planning, and we would have that discussion with them before that meeting to make sure they're good to go.
Okay.
Yeah, I'm supportive. This is Carmen. I'm supportive of moving forward, and I'd like to see some of the documentation, which I haven't had a chance to look at, but sounds good to me.
Great.
Okay. Do we need anything else today, Shelley?
Could you do the warm weather, balmy temperature dance?
No, I don't dance. I've got 2 interns in here that day.
Yeah, really?
Given that assignment.
Yeah, that would be great. I think that's all. Thank you so much for facilitating, Tammy.
Thank you, Shelley, and thanks, guys. And I will send out a follow-up meeting for our group.
Okie dokie.
Thanks.
Bye.
Yeah.